Hey everyone, it's Dr. Natalie Gunning with Spalding Therapy. I thought as the weather warms up, it might be a good time to talk about running and a few ways to prevent injuries with running. If you're already having pain with running in your knees or hip, I encourage you to talk to your physician or physical therapist before starting any of these exercises. Again, these exercises are just to strengthen some muscles that I notice can cause increased pain in runners and lead to injury. The first exercise I want to talk about is the clamshell exercise, and this targets a muscle called your gluteus medius, which is the lateral aspect of your hips. Basically what the glute med does is it keeps your pelvis stable when you're running or walking. When they're weak, it affects the opposite side. So if my right glute med is weak, it's going to cause my left pelvis to drop. When your pelvis drops, what it does is it causes an increased valgus or medial motion of your leg inward. So it's bringing your leg inward, which puts increased pressure on the medial aspect of your knee, where your medial meniscus and your MCL are. It also puts your patella or kneecap in a poor position and puts your IT band in a poor muscle length tension ratio, which can cause tightness and lead to iliotibial band syndrome. So this is why the clamshell exercise is so important. For the clamshell exercise, you're going to start laying on your side with your hips stacked. You want to make sure your knees are together, your feet are together, and your knees are bent in. So I'm at this kind of nice little 90-degree angle here with my legs. You're going to keep your feet together, hips stay stacked, and you're going to lift your top leg up. The big cheat I see is a lot of people try to roll backwards. That's not working the muscle we want to, so again, make sure those hips stay stacked. So you're going to lift your top leg up, pause, and then slowly lower back down. You'll start feeling some fatigue in the lateral aspect of your hip and glute muscle here. If you want to make this harder, you can always add a TheraBand or some weight. I recommend doing 10 to 15 reps, 2 or 3 sets on each side. So again, you're just going to come up, pause, and then slowly lower back down. And that's the clamshell exercise. This exercise I want to show you is called the lateral step down. Now this exercise is a big bang for your buck. So not only are you working on balance, you're working on core strength, hip stabilization, quadricep strength, hamstring strength, balance, proprioception, and ankle mobility. So there's a lot going on here. Exercise is a lateral step down, which is actually good for me. I have some hip issues, so you'll notice I have some difficulty performing this exercise. All I want you to do, you're going to step on a step. You can use a step in your home. You can use it on your porch. If you have poor balance, I'd recommend something that has a rail that you can hang on to just to help with your balance until that gets better. So this is the basic setup. You want your feet and your knees facing forward. You want to avoid any sort of extra medial glide of your knee or over pronation where your foot kind of tilts in, and you want to maintain your balance, obviously. So we're going to step up, and then I'm going to lift my toes up, and I'm going to slowly lower down into a single squat and try to tap my heel. So we're going to come and then come back up, come down and come back up. Whew. All right, so something we don't want to see is when you come down, this would be improper. This is not what we want. So again, we're going to go straight forward, tap, and then come back up. And that's the lateral step down. You can also progress this by doing it on a higher step, holding a weight. You can work different planes. So you can try the forward step down, same thing, trying to watch your knee, making sure it doesn't go too far forward. Finally, stretching. Most runners are notoriously not very good at stretching, myself included, but foam rolling has really become popular in the last few years. A lot of people like to foam roll their IT band. It's important to note that the IT band is not actually a muscle, it's a connective tissue that is an extension of a muscle called your TFL, or tensor fascia lata, and extends down the lateral aspect of your leg and attaches to the lateral tubercle of your tibia. So usually when this muscle gets tight, it's from poor muscle length tension of your hamstrings, or tightness in your hamstrings, weakness in those glute med muscles that we talked about that causes a shift in your knee, or other improper running mechanics such as overpronation of the foot and other muscle weaknesses. So usually rolling your IT band is pretty much painful and not generally all that effective. What I actually recommend is working what we've already talked about, and then foam rolling the muscles that kind of surround your hip joint, especially the hip flexors, even working in on this area of your pocket where your TFL is more likely to lie, making sure you really roll out your glutes and your hamstrings, and that'll also help take some tension off that TFL. So here's a couple foam rolling techniques you can do. I would avoid doing your IT band if it's super sensitive. It just causes pain and isn't necessarily fixing anything. So again, I'm going to show you how to do your hip flexors, kind of focus on that TFL area, your glutes, and your hamstrings. So first we're going to work on our hip flexors. So I got this from Five Below. You can order these on Amazon or get them from any Dick's or Sporting's goods store. You're just going to lay on it I'm just going to kind of use my arms and rotate a little bit up. So if I get on a tight spot or something that's a little bit tender, I might hold for about 30 seconds statically. But really for 30 seconds to a minute, you're just going to kind of explore the whole muscle. Go up, I can get a little bit more in my quads. If I go more towards my knees and then more up to my hip, is getting a little bit more of my hip flexors. If I kind of rotate to the side where my pocket is, I'm really getting those hip flexors and a little bit more TFL focus. You can keep kind of going over to the side and get a little bit more of your hip abductors. So up in here a little bit. Again, down here is going to be more your IT band. It's generally painful and it's not going to be overly helpful to roll that out. So I'm going to get up here in my hip abductors. You can rotate around and then move to do more of your glutes. So kind of rolling out here. Again, you can do longer if it's comfortable. And then you'll start coming down and do your hamstrings. So again, I got a little tightness here, so I might do a little bit extra here. And that's how you foam roll. So that's just a few easy exercises you could do at home to help prevent any injuries with running. If you have any questions, feel free to email me at ngunning@spalding.edu or leave a comment below. I appreciate your time. I hope everyone stays well, stays safe, and runs healthy. You guys take care. Bye.